measure and see exactly where the granulation tissue is, then we will stage it, and you're right, it is more than likely a stage 4. But before we debride it, before we clear the eschar, we cannot stage it. And then, after we do that, then we can go ahead and stage it, and you're absolutely right, it is going to be a stage 4. So it's a matter of semantics.
But for the book purposes, we have 1 for 4 and then
Unstageable. So you're unstageable, let's read it. It says an unstageable pressure ulcer, of course it's full tissue thickness, that's what we just called a stage 3 or stage 4. Tissue loss, wound base covered by either slough. What is slough?
Yellow stuff.
Slough is that, slough, yes, that yellowish, grimy, gray, green, brown, tan, and or eschar in the wound bed. And so we can't stage that. It is not possible to determine the true depth with eschar. You can't. If you don't know where the granulation tissue is, right? So you actually cannot stage it, theoretically, legally. Now, once you are done with that, once you clear that, yes, it's a freaking stage 4. Well, why couldn't I just say that in the first place? Because you didn't have the measurements. Does that make sense? You had a good educated guess, but you didn't have the measurements. Now that we have debrided it, now we can call it that. But in the meantime, guys, it's unstageable. So eschar slough is actually unstageable, okay? And then we will debride them, do what we gotta do, and all that other shindig, with whatever the physician has ordered for our wound care for this particular patient based on their particular individual situation, whatever it is that they got going on. Your job, nursing interventions, is simple enough there. They talk more about it in foundations and all that stuff. Wound care. All right, let's go into herpes simplex. Ladies and gentlemen, you need to know the difference between herpes simplex, we call it HSV, type 1 and 2, and herpes zoster, okay? That's shingle, you got it. Okay, that's varicella. You know that you need to know the difference between HSV, herpes simplex virus, then between HSV and herpes zoster. And then, let's go back to HSV for a moment. Not only do you need to know the difference between HSV and herpes zoster, but in HSV, you need to know the difference between type 1 and type 2. So there's 3 different things going on. And don't get them all mixed up. HSV, herpes simplex virus type 1, we call it a cold sore or a fever blister. We get them on our lips, on the corner of our nose, sometimes on our oral mucous membranes. We get them when our little immune system gets low and we're about to, blah, blah, blah. Go into get a cold, get sick. We get them in the winter, blah, blah, blah. HSV type 1, we call it a cold sore or a fever blister. Ladies and gentlemen, HSV type 2, you got from doing the do. All right?
Monique,
don't be
laughing.
Type 1. Herpes simplex virus type 1, not herpes zoster. Herpes simplex type 1 is the cold sore, the fever blister, the lips, the oral mucous membrane. Go ahead, Chris.
Can you get type 2 from type 1?
You can get, no, but you can auto-inoculate with type 2 from the genital to your mouth, throat, and anus.
So you can get type 1
Spread it
from
yourself.
type 2.
Spread it within
No.
yourself.
You can,
You spray it with
No.
So if someone has type 1, like blisters on their mouth, let's say
That's
they
how it works.
sexual activity,
If it's-
could
if
it
it's
pass on to
pleasant.
genitals?
And
Yeah,
They can, but
it
yes,
comes once and then it never comes back.
they can in that sense, but it's not a type 2 type thing yet.
So it's still, even though it's on your genitals, it's type 1?
Yeah. Because it's a kind of
And
So
then-
type 2, it's just
and
type 1?
it has a different lifespan. It has a different it can go away and not come back.
It's self-limiting.
It's self-limiting, that's the word I'm looking for, thank you, Laura. It is self-limiting,
Outbreak and then never again.
it is
If it's
self-limiting.
incidental, so
If you get the
whichever
mouth
one,
one and you
pass
give
it
it,
on to,
you do oral sex on someone, if you have a mouth one, you do oral sex on someone, you give it to them genitally,
It
you'll
is
get it once,
self-limiting,
and then it will never come back.
but it's not, okay.
it
And
is
it's still,
self-limiting.
it's still a one.
Now,
They do alpha for clarification.
let's switch over to type 2, genital herpes. There is no cure and it never goes away for your,
For
like,
both either, not just.
yeah, there is no cure.
Yeah.
They're viruses, right? So, hear me out for a minute. What's gonna happen, depending on how bad the patient, is and how often they get flare-ups, we are going to prescribe a cyclovir, the Virs. One of the most
There's
popular
another one,
is,
valacyclovir.
huh?
There's valacyclovir.
Valcyclovir, cyclovir, the Virs. Those are the popular ones, there are other Virs, okay? Now, will this Vir cure type 2? Absolutely not. What will it do?
Control it.
It will shorten the length of the outbreak. Just like that stupid thing called, we gotta make some money, y'all. We gotta make some money. You people are making money. What is this one called? Abreva. $18 container for Abreva to put on a cold sore that shortens it by 2 days. I can go to lunch with that $18 for two. What the hell I wanna shorten a cold sore by 2 days for
Physical
$18?
appearance, people can see it, it's on your face.
It's 2 days. It's
But
already, by then, it's
valacyclovir
already crossed
is
over.
shortened it by
What
like
if your wind was this?
5 days, no?
And, hell no.
No, valacyclovir.
No, Abreva, we're talking about Abreva, $18 for a tube like this, that's supposed to shorten this cold sore for 2 days. Mind
Actually, it's
you,
expensive.
that is only if you started treatment within the first 48 hours.
Which sometimes you don't have a bump within the 48 hours. to
Boom,
know.
boom, bang, bang. So then you go buy this $18 shindig that's gonna shorten your cold sore for 2 days, that really don't shorten your cold sore for 2 days, cause you missed the window. So we can make some money, y'all. We gon' call something a beer, and we gon' sell it for 15. And we're gonna say it's gonna shorten that cold sore by 3 days.
I'll invest 10,000.
We gonna make some money.
But why is it expensive?
All right, let's come back, let's come back, let's come back, let's come back.
Another 10,000.
Let's come back, let's come back. So, these people are gonna be on the VIRs, the antivirals, right? Type 2. I don't want to get so much into type 2 because we're gonna cover this in
Here,
repro.
clinical
But,
manifestations.
type 2, there is no cure for herpes. People in the prodromal period, or when they're about to have an outbreak, can feel a tingling sensation. And so most people know when they're about to have a herpetic outbreak, they get that pain, that tingling sensation and that pain, and that triggers them, the
Spiders.
and that triggers them to start their acyclovir or their valcyclovir. And so they are contagious, by the way. Type 2 is contagious even when the patient doesn't actually have a blister.
Oh, I didn't know that one.
More contagious in the prodromal phase, and of course while the virus is shedding. Okay, so let's turn the page.
Once
We're going
they've
to talk about
crusted,
herpes.
once they make that crust.
They are still contagious.
Even with type
I
1?
thought they weren't contagious after they make the
They are
crust.
still contagious.
Even with
Yeah, I
type
thought it was
1?
the, I knew the.
So the
They're
rest
still
of them
contagious.
have to
But I didn't know
pops
even when
and
you
that crust.
weren't.
The
Turn the
virus
page,
is still
let's go
there.
there. Turn the page, wait, Laura first, hold on, Laura?
Type 2 mentions that flu-like symptoms occurs 3 to 4 days and the vesicle erupts. But in type 1, they don't say what the length of it is.
Typically type 1, it could last typically anywhere from 7 to 10 days, give or take. And then, Mona,
So you said type 2 is more contagious.
More?
One.
Huh?
go ahead.
More contagious even with no blister and more contagious in prodromal
especially when they're shedding, when the virus is shedding, okay? So turn to page 69 and let's look at
So
it.
it's type 1,
Go
right?
read.
Yeah,
Type 1 is contagious too when they're shedding, yes, they're both contagious when they're shedding.
What does shedding mean when it's crusty?
Yeah.
When it's already
When,
crusted?
yes, once the lesion has opened, because there's gonna be a lesion, a painful lesion, it's gonna pop,
The
appear,
fluid, the vesicle.
then the vesicle, that's the word we're gonna use, because it's on this list here, right here. We
But when
talked
it's an
about-
actual full-on scab, like when it's
The-
a scab and you,
Once it's
Pick it off.
scabbed completely.
Why are you picking it off? Don't
I'm
teach
just
your
saying,
patients to
someone-
pick off scabs.
could that still be?
Yes, yes, yes. The reason a scab is there, like I have one on my knee right now, a big one from when I fell. The reason a scab is there is to protect the exposed skin underneath. So there's still viral there underneath that's trying to do its thing, and then we open that up again, then they have another round of shedding. Okay, so, here on page 16,
How do you get the first one?
your immune system goes down. It's just a typical, it's just a cold sore.
No, but like, how do you
But like,
get it?
how do you get your born? Everyone's,
Transfer.
No, it's just a virus.
Transfer it.
It's just a virus. You get a
so
virus
like
on
when
your
you have a
hand,
cold sore and you kiss a baby, the baby.
yes,
Mhm.
can get it.
Drink
Yes.
water from the cup.
Yes, it's just a virus, just the way we get any other viruses. They're all in there.
And it's versus saliva too?
Yes.
Or is it just actual
Is the
vesicle,
virus
like-
in the saliva? I don't know if the virus is actually in the saliva. The virus lives in the vesicles.
Third.
So I'll have to look that one up
I think you did look it
to
up.
speak about some, but hell, ain't no, if you got a fever blister, why you licking people, right?
I can't kiss you, but I
Or
can
why
look
we
in the
cry, hey, so, you know, and if you've ever, I get them, I got my first, not my first, but my first real herpetic outbreak. It was so horrible. I went to go have my daughter, and, they gave, she's C-section, and I had, Duromorph for a spinal. And after I came out of the OR, well, guess what? I'm allergic to morphine.
Oh.
And I started one itching that was just uncontrollable. There was no amount of Benadryl that they could have given me. There was no amount of nursing intervention that they could have done. It was just,
Guided imagery.
yeah, right, guided imagery. And the thing was just horrific, and I scratched so hard, and I guess my whole immune system shut down.
And you got it.
And a few hours, or I think it was the next day, I woke up with this thing, this kid has it right there on, figure 32, from one side of my lip across to the other. And I could, you know,
And you
just,
didn't kiss your baby.
Yeah.
no, I didn't even want her near me.
You remember that baby that died because somebody who has like herpes? Yeah.
Yes.
Remember? Yeah. She died. The baby died.
That's
What's
why
the-
if
It
you
was
have
2-3
genital
years ago.
herpes, you have to tell your doctor when you're having your baby.
Yeah,
And
we're
you have to
gonna,
be super careful because they can get it in the birth
that's
canal
the
and it can
C-section,
kill
yeah.
your baby.
And we're gonna talk about that more in maternity, or as we go to report, this is gonna come
I think the
back
baby
again.
had a birthday, and then somebody from the visitor had herpes and kissed the baby and died.
How old is baby?
Like one.
Oh my God.
First birthday and last birthday.
Yes.
Oh my gosh, that's horrible.
Do they figure out who gave the baby?
Yeah, because then the relation was at the party.
Yeah.
Oh my
But
gosh.
if, aren't you, when you're pregnant, he'll give you medicine to take, right?
Yeah, but if there's an outbreak,
How
it's a
did that
C-section.
happen?
But if it's sexual
It's not if
memory,
you
said
have
you don't
ever
have
had it,
to-
when you're having an outbreak.
No, someone was the visitor.
Outbreak, it's an automatic C-section, but we're gonna cover, excuse me, all of this stuff in repro.
Oh, in
Come back
repro.
in repro, type 2,
Did it happen just because the baby had a low immune system, no immune
more
system?
than likely, more than
But
likely.
babies
But
also.
baby is vulnerable.
It's a baby,
So
they're
it was,
Yeah.
automatically,
it was the right.
They're
it was
automatically
the right-
it was.
It was
Yeah.
a bad thing at the wrong time,
Yeah.
at the wrong
Yeah.
time.
yeah, no, I didn't want my kids, so this is my first baby, just had a C-section, you know, gonna be nursing, stupid morphine, no one knew I was allergic to morphine, it was nobody's fault, you know, I found out the hard way.
Are you still allergic to morphine? You are?
It doesn't go away.
Ooh.
And so, ever since then, ladies and gentlemen, I do, when I get immune compromise, when my immune system is low, it is possible that I will get one there and
But also because it's viral and your body builds up antibodies, the first outbreak is always the worst. And
Oh,
subsequent
my God.
outbreaks
From one
are
side of my
always
life to the
less
other.
bad and less frequent, same with genital.
Ugh.
It depends, it's not always.
So, let's go here. If you turn to page 69, there's good reading there, ladies and gentlemen. Ladies and gentlemen. Ladies and gentlemen. Ladies and gentlemen. Shh. Page 69. Ironically, page 69.
Hey, you need to go to church, Miss Humes.
Best page number in the book.
I did not make this up.
You told us not to correct you.
Yeah.
On page 69.
I don't know what that
We're
means.
rubbing
Page 69
our
what's the
Hey,
reference to?
you need to go to church.
What is it referencing to? I don't know.
Herpes.
We didn't even notice that. Oh my
Right there
gosh.
on page 69, upside down. You better talk to Cooper and Gosnell, please.
Yes.
Those people are, ladies and gentlemen, bring it back. Page 6, good reading. I can't tell you how much information is there in such a simple fashion. Ladies and gentlemen, you cannot go wrong with reading this. You cannot go wrong. Okay? You can't go wrong with 69, you just cannot. And so,
Oh yeah, you can never go wrong.
there's a lot of information there that I need you to read. Get your highlighter out and start, Jeff, you got a whole bunch of them. And start highlighting your clinical manifestations. What does that mean?
Same.
What does my patient look
like?
So what's wrong with my patient? They're having a viral outbreak of herpes simplex virus, not herpes zoster. Type 1 or type 2? Type 1, fever blister, cold sore. Type 2, got from doing the do. What do they look like? We call it clinical manifestations.
It's in the
Well,
middle.
there's one right there in figure 3-2. And so all these symptoms or signs and symptoms is right there. And what's the last question? What are we gonna do about it? Acyclovir, sometimes nothing.
Isolate.
Most of the times nothing.
Isolate the patient.
There's
right?
no reason to. Nothing.
Just for type 1 or?
Type 1. So for type 2 too, sometimes we don't do anything for type 2.
Yeah, what are you gonna do?
There's nothing to do. What can you do? Let's go about what you can do. So listen to me carefully. Most of the time, there's nothing to do. Why? Because it's a fever blister and it's just gotta run its 7 to 10 day course. What can you do? Nothing.
But if you're taking
However,
if you're taking the beers, it would shorten it and dry it out faster.
If you started.
I never have taken any beer for any of my cold sore. Not a one. They're not that dramatic.
That's just for type 2 though.
You never use a brief.
I've never used a Breva, I've never taken a Cyclovir, I've had quite a few of them. And let's not talk too much about them, because you know, they're messing around and come back. We're in what, November, December, so let's not talk too much about them.
It's automatic.
So,
They show it.
ladies and gentlemen, let's wrap this up so we can go.
Spider
Oh,
16
go.
lead.
Now, the comment that I just made was, what? Most of the time. What happens most of the time? Nothing.
Nothing.
That would beg to leave what? The rest of the time. Oh, there you go, girl. Took the words right out of my mouth. That would beg to leave the rest of the time, Ms. Hughes. Well, what about the rest of the time? What are we doing the rest of the time? We're treating the symptoms. What are the symptoms? Pain.
Produce burning pain.
How do we treat pain? Pain meds. Ding, ding, you see how this thing is going. The other one is, or sometimes we can do a warm sitz, but go read your book, it's right here.
Can you take NSAIDs like anti-inflammatory?
Yes.
How about oatmeal?
Probably soothing.
Over the counter stuff, soothing. soothing, blah, 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 and blah. That's what we do for the rest of the time. Your veers, the acyclovir. If this is herpes simplex types 2, and the patient feels that paresthesia, they're having paresthesia, they know they're gonna have an outbreak, then they wanna go ahead and take their veers, their acyclovir, famciclovir, valcyclovir, whichever veer they so happen to have based on their insurance company and they, all this stuff, all right? So, diagnostic tests. What is the diagnostic test for herpes? Most of your skin diagnostics are culture and sensitivity. A lot of your skin diagnostics are biopsies. When we're looking for cancer. So cultures, we're going to get a culture and rule in or out whatever the lesion is that we need to swab. Alrighty then, your medical management, again, these things have no cure. There's no cure for herpes virus. And so the lesions will spontaneously resolve. Usually there's no complication. If we need to, we go to our veers and all this other stuff that I'm not about to read to you because it's so easy and written in such a simple manner. Turn the page. 70 and 71. You got a lot of meds for your integumentary system. Look at acyclovir. Go over to nursing implication. Ladies and gentlemen, do you see the term topical there? Most of your skin things are going to be topical. Most of them. Some will be systemic, but most of them are topical. Please do not touch skin to hand to medication. What am I saying? Please, well, it's not don't get it on you, but
Don't spread
please
it.
do not take your dirty hand and put them in the nice uncontaminated medication and then put it on a patient and then get their germs on
And put it back.
top of that. Okay, you're just spreading things all over the place, from the content of the medication to your hand to the patient back to the so gloves, number one. What else?
A tongue suppressor or
A
swab.
tongue depressor or a Q-tip swab. Okay? Please use an inanimate object to apply ointments.
And use a new one every time you
And
go back in
use
there.
a new one every time. Please use an inanimate object to apply ointments. Esta dice nomás. Go down, and the next big one, your corticosteroids. You're gonna run into the big dogs of the integumentary system will be the corticosteroids. Why? Well, it's inflammation. All these things are about inflammation, right? So you run into your corticosteroids there for the inflammation. Accutane is at the bottom of that page. And all the drama, not all the drama, but some of the drama that come with it is listed there, except the really dramatic stuff like the liver and the kidneys and all that stuff you'll find. It's probably in your book somewhere, like under the real thing. You need to grab your jug guide, open Accutane, and go to town. All right. So all this shindig, this nursing implication, as we mentioned earlier, who was it? We were talking about, I think I was talking about the 2 pregnancy tests, the 2 types of birth control. You actually have to literally sign a waiver to take, ladies have to sign a waiver to take Accutane. You can't just, ladies of childbearing age. They don't care, I could use Accutane, I'll take it. Okay, all right. Your next medication on page 71, ladies and gentlemen, Lindane. Quail.
Oh, and Jane.
That is your scabicide. We're gonna talk about scabies in a minute. And so that is the, 3 things about scabies. What's wrong with the patient, what it look like, and what we do about it. This is part 3, what do we do about it? Okay, it's called Quail, Lindane. Here are your medications. Yes. We're gonna cover these things in 3 sections. We're gonna cover the bacterial infections, the fungal infections, and then the parasites. Okay.
Rice counts as a parasite too, right?
Yes. So quail, your scabicide. That means later on, we're gonna talk about quail and we're gonna talk about permethrin. And I need you to figure out, because I'm not gonna tell you, I'm gonna ask you, when do you put it on the patient? How long do you let it dwell? What's going on here? So grab your drug guide. I'm not gonna spoon feed you about these things.
medication?
Where's the?
That's
What was the name
on the
again?
rid and
Where's
others?
Permethrin? I don't know, it's somewhere in your book,
Is
probably.
that the rid and others?
No, Permethrin, no.
Permethrin.
Pimeclumus?
It's called,
A cream?
P-Y-R-E-T-H-R-I-N?
no.
Okay,
Permethrin.
permethrin.
It's,
Where is it?
I don't know.
That one.
it's called, what's the layman's term for permethrin? It's called, Elamite. It's
Huh?
called Elamite.
No.
Okay, you don't see it there because it's not there, I'm telling you.
Oh.
So
You're
make
telling
your,
us to
these are your drug,
Elamite?
Elimite, 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 Permethrin, P-R-M-E-3.
Okay, thank you.
Medications, yes, I'm telling you the medications that I'm gonna hold you responsible for. Your drug cards, update your drug cards. Elamite, E-L-E-M-I-T-E.
Okay,
Update your drug cards.
okay, we'll do.
Quell, Elamite, Rid. We used to use Nix. I think they took Nix off the market. I believe they took Nix off the market. Your pediculicides, Rid and Nix. And yes, I gotta look it up. I believe Nix is off the market. All right. What else is on this page? Your nursing intervention, this page continues from your nursing interventions from herpes simplex type 1 and 2. Your nursing interventions, what are we gonna do about it? Your book says number 1, your interventions focus on treating the symptoms and preventing the spread of the disease, please, okay? The patient can use warm compresses to relieve the pain and the pruritus. What did we say pruritus was?
Itching.
The itching. Type 2 herpes virus or genital herpes may be transmitted by viral shedding even during periods of remission. Read your books, it's right there. All right, so turn the page. Let's go to 72 and 73, and I'm gonna stop at 72. All right. Then we go to the other herpes, not the simplex virus, the zoster, or what we call shingles. Who does this share a common denominator with?
Chickenpox.
Chickenpox, we call it
Varicella
varicella.
zoster.
Okay, so this shindig lays dormant in the nerve root, in the nerve cell. And when the patient becomes immune compromised for whatever reason, stress is a big one, right? Then boom, boom, bang, bang. Mostly, a lot of our geriatric patients. What are the important things, guys, about herpes, herpes zoster? NCLEX 101. What is the big deal about it?
Severe pain. Severe pain.
Severe pain.
And it runs along with.
It runs along the dermatome. What else? Severe pain, and it runs along the dermatome. Ladies and gentlemen, there are times, please don't be judgmental. There are times, and you know, too big for your britches. There are times when a geriatric patient will come to you and they will say, nurse, help me, I'm having chest pain. Nurse, help me, I'm having chest pain. Oh my gosh, it hurts so bad. And you're a nurse and you're like, oh, chest pain, EKG, right? And then you do all your shindigs and you, oh, no, GI, oh, no. And then everything comes back negative and you're like, you're crazy, cray. And they're like, no, my chest hurts, it hurts so bad. And you look and there's nothing. Please start thinking about shingles and medicate your patient for pain. There's no blister today, but the patient is in pain. Guess what's happening? It's coming. The nerve endings are on fire, and the blister is coming. When you see them tomorrow, you're gonna be so mad at yourself, like, oh my gosh, I called you cray-cray. The whole time you had a whole dermatome running along your Okay, they're in their prodromal period. They're getting ready to have a zoster outbreak, a shingles outbreak. But sometimes the pain comes before the outbreak. Okay, sometimes the pain comes before you can see it. So now you have another thing to add to your chest pain list. Wait a minute, is it musculoskeletal? Wait a minute, is it GI? Wait a minute, is it pulmonary? Wait a minute, is it cardio? Oh, wait a minute, is it integumentary called shingles? So be nice to your geriatric patients in their long-term environment, and they're telling you they're having chest pain, and telling you it's hurting, and you're like, there's nothing there, oh my gosh, so crazy, why? You'll see it the next day or two. Then you should feel really, really bad about yourself.
Yeah.
All right, so this lies dormant until again the person gets some kind of immune shindig. Right there, it's easy reading. It's, gosh, these etiologies and pathophysiologies is less than a paragraph long. Ain't no reason why you shouldn't have read this whole book already. So what's wrong with my patient? They've got a varicella laying dormant, blah, blah, blah. What do they look like? Fire. They're on fire, okay? Those nerves are painful and it's on fire. Does anyone ever know anyone? Does anyone know anyone that's ever had shingles, real shingles?
Yes.
How did they come at you, Rosa?
Super painful.
Super painful? What about you, Jasmine? How did the patient, was it a patient or somebody else? How did they?
Like burning, like.
My chest is, chest?
Yeah.
Sometimes, of course, back as well, flank.
Why are you on the chest?
It's the pain, it's the whole nerve that's running along that whole dermatome is on fire. It's burning, it hurts so bad.
Because they couldn't even walk. Why is it, like, I've seen it many times and it seems to be
Always usually right here,
always running
yeah.
alongside here. Why
It's
is
just
that?
that's just called a dermatome. You've got dermatomes all over and it just runs along, it likes this
I'm
dermatome.
gonna say, like, most of the time that I've seen it is always running alongside here.
Patient was in pain?
I've seen it on the face and the head.
Yeah. Now, shingles are highly contagious. Your patient, your geriatric patient that's having a shingles outbreak need to be on contact isolation, okay? Make sure that you guys have contact isolation. That's your nursing intervention for those patients. So pain. Even without the outbreak, the patient is in pain. Go, Chris.
How about if you never had chickenpox, you can still get shingles?
You can, especially even if you've had the varicella vaccine, that means that you are, because we did immunity already, right? Vaccines are a type of immunity, you build up those antibodies still. All right, your diagnostic test. What is your diagnostic test? It's the skin, we're back to the same thing. It's a culture to find the culprit, but the reality of it is, there's usually none. We don't need a diagnostic test, except for our eyes and a good H&P, a good history on your patient to realize that they have herpes, okay? What are we gonna do about it? Well, we're gonna treat these people's pain. They're in pain, they're in a lot of pain, okay? So let's control the pain, let's prevent secondary complications. The earlier we catch the shindig, hopefully the easier it is. It's a virus, so we're gonna put them on the VIRS, right? Acyclovir from cyclovir. And there's a herpes zoster running along the upper dermatome in 3-3. All right, ladies and gentlemen, we're all herpes out for tonight. Hold on.